Hello and welcome to the EMS On Air podcast. The mission of this podcast is to keep healthcare providers safe, informed, and prepared. Today is February 17, 2021. This episode was recorded on January 29. I'm Jeff Lassers and I'll be your host. Even though we are located in Southeast Michigan and we mention our home state a lot, today's content applies to EMS on the national and even the global scale. In Season 2, Episode 12, we interviewed Jennifer Combs, a nurse practitioner from Healthy Mothers, Healthy Babies Coalition of Broward County, Florida, and Captain James Carroll from Fort Lauderdale Fire Rescue. These two fantastic people have teamed up for about the last decade to create and grow the Direct On-Scene Education Program, more commonly called DOSE. DOSE is an innovative attempt at eliminating sleep-related infant deaths due to suffocation, strangulation, or positional asphyxia by using first responders to proactively identify and remove hazards while delivering education on scene. First responders are trained to identify and remove hazards from an infant's sleep space while on scene during an emergency or non-emergency 911 call. During that episode, Jennifer and Jimmy revealed some startling statistics that really opened my eyes. Every year in the United States, about 3,600 sudden unexpected infant deaths or SUIDs occur. These deaths include infants less than 1 year old with no immediate obvious cause. There are three most commonly reported types of SUID. The first is Sudden Infant Death Syndrome, or SIDS, which is a term we're all familiar with. About 1,600 infants died of SIDS in 2017. The second includes approximately 1,300 deaths each year from truly unknown causes. The third most common type of SUID is accidental suffocation and strangulation in bed. These preventable sleep-related situations account for about 900 infant deaths each year. Here's another fun fact about the county where I live and work. Between 2010 and 2017, there were 77 sleep-related infant deaths in Oakland County, Michigan. That's too many, especially when I learned that these deaths are preventable. In this episode, we welcome back Dr. Sam Mishra and Terrie Godde to talk about how EMS agencies in Michigan can easily and painlessly adopt and implement DOSE with the full backing of the State of Michigan EMS for Children program. Sam is the EMS for Children coordinator for the state of Michigan, and her job is to support EMS agencies with access to information, programs, and resources that will make them better prepared for pediatric emergencies. Terrie is the state of Michigan EMS education coordinator. She oversees initial and ongoing education standards for EMS in Michigan. Today, Terrie and Sam will help us appreciate what is at stake for newborns sleeping in unsafe situations. Then, they'll describe what the State of Michigan EMS system is doing to limit preventable infant deaths by providing support and resources to EMS agencies to adopt and implement DOSE. Before we get into the meat of the show, I just want to say one thing. DOSE doesn't just prevent infant sleep-related deaths. It prevents parents, caregivers, and EMS providers from the experience as well. As first responders, we see and go through enough hard stuff, and DOSE is one way to help limit the number of bad experiences that we might endure. So, if you're considering adopting DOSE at your agency, you're not just saving babies. You might be saving your coworkers, future EMS providers, and maybe even yourself from the experience of running on an infant sleep-related death by eliminating the problem before it happens. Prevention works, and we're here to prove that. To learn more about how you can implement DOSE or obtain more information, go to their website, doseprogram.com. And you can find our guests' contact information in the episode description. Please keep emailing your comments, questions, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org. Also, check out our website, emsonair.com, for the latest information, podcast episodes, and other details. Follow us on Instagram at EMS On Air, and please, whatever podcast platform you use, subscribe to our podcast and leave us a rating and a review because it really helps us to grow this thing. Thank you, and enjoy the episode. Good morning, ladies. How are we?
We're good.
Doing good. How are you?
I'm good. Good morning. Terrie, let's start with you. Can you please introduce yourself, who you are, what you do, and where you do it?
Sure. I am longtime instructor coordinator I've been in the EMS office now for over 8 years as the EMS education coordinator for the Bureau of EMS Trauma and Preparedness. My background, other than paramedic and an IC, I have a bachelor degree in healthcare administration and a master's degree in educational leadership.
Well, that's awesome. Welcome back to the show. We always love having you. From a state perspective, it's always nice to have our education leader here to kind of tell us what's going on in Michigan and kind of compare and contrast to other states. Speaking of which, Dr. Sam Mishra, you were here earlier this week. Welcome back to the show. If you could please remind our audience who you are, what you do, and where you do it.
Thank you, Jeff. So I'm Sam Mishra, or Dr. Sam, as some people like to call me. I'm currently the EMS for Children coordinator. I work really closely with Terrie over at BETP, actually in the Office of EMS. My clinical background, I was an ER doc for a while and also pursued my master's in public health. I had a really big passion and focus on preventing pediatric illness and injury and helping families, parents, caretakers advocate for their child and take really good care of kiddos. So this opportunity came along and I learned all about EMS for children and just jumping in with both feet.
That's awesome. So specifically today, we're not just talking about children. We're talking about the little tiny puppy children. Let's talk about newborns. From what I understand and what I've learned over the last year is that infant safe sleep is a big deal. We did an episode with Jennifer Combs and Jimmy from down in Florida about their direct on scene education program. And really that got started about infants and safe sleep and making sure that we keep people out of unsafe situations. Terrie, I know you've worked hand in hand with them because you introduced them to me. Can you please help us appreciate what is at stake for newborns sleeping in unsafe situations?
Sure. So one of the areas that I think is the most important to understand is EMS has always been a response to a situation that's already occurred. One thing that DOSE, when it was introduced to me, Michigan Public Health Institute brought Captain Carroll up from Fort Lauderdale to talk about his DOSE program, asked me to attend, and it really is how we as EMS first responders are the missing link in helping to prevent these deaths. There's about 3,500 to 4,000 infant sleep-related deaths every year in our country. Around 150 each year in our state. As you can see, 2/3 of those are found to have been from completely an unsafe sleep environment. And once you understand the role of the first responder who can help educate families when we're in their homes, who can recognize unsafe sleep practices for infants and newborns, there's a couple advantages. One, they trust us. They trust what we have to say. And two, we're in their homes and we can see the situation. One of the great things that we've been able to do in our department is to purchase some pack and plays. And those pack and plays can be distributed to those people who cannot afford or don't have access to a safe sleep environment. So this program, I'm very excited about doing this podcast. Very excited about this program. That's kind of a quick overview of DOSE. For specific statistics, there is a link called keepingkidsalive.org. And if you go to www.keepingkidsalive.org/publications, you'll be able to get updated data on infant sleep-related deaths here in Michigan. And if you look at the city of Detroit, for instance, 3.4 out of 1,000 infants die in their sleep. That's a statistic.
So Terrie, can you kind of break that up for us? Because from what I understand, what was really highlighting to me is when I talked to the people that developed DOSE is that SUID, sudden unexpected infant death, is really broken down into multiple things, whereas SIDS, sudden infant death syndrome, we always kind of put that all together in our education. It was a little bit confusing to me initially, but now it makes perfect sense. SIDS is really an unknown thing, but there is accidental suffocation and strangulation in bed that we're actually talking about. We're talking about preventable things, correct?
That is 100% correct. Yep. Preventable things. Like I said, 2/3 of those preventable things are what's causing our infant deaths in our state, in our country. So 2/3 of those deaths can actually be prevented. 1/3 are those true SIDS cases. And we really, in our field, need to get away from saying SIDS out loud because it can take over a year to find out if that child actually did die from an unknown, unrecognizable cause. So by giving someone a false sense of they did everything right, we just have to get away from saying SIDS, because we truly don't know, and no one will know for quite some time. There's a lot of information that has to be done besides the autopsy and the environment inspection, and then sometimes they have to do genetic testing from family members. So it does take a long time to actually diagnose SIDS, which is unknown. But the other two, like you said, sudden unexplained infant death, consists of accidental strangulation and suffocation in bed. And this program really hits that home, how often we go on these calls, and these calls are horrible. We remember every single one of these calls. And what do we say to these families? It's just a horrible situation, certainly for them. It's a horrible situation for us, and that stays with us. If we can be part of the prevention in that, what a deal.
Absolutely. I totally agree. And it sounds like that we already have the programs existing. We just need to adopt what other people have done successfully. After talking to Jennifer and Jamie down in Florida, they've decreased quite a bit of sleep-related infant deaths in Broward County. I'm trying to reproduce that here. Can you give us a down and dirty overview? Kind of already talked about what DOSE is, but just give everybody an idea of what it takes to implement DOSE into their department. What is it? Is it a lecture?
Sure.
Is it a program? What kind of commitment am I getting into here?
Excellent. So DOSE, it's an acronym for Direct On-Scene Education. It is trademarked. This training is 1 hour, and it really hits home what these unexpected deaths are caused from and what we can do as first responders to help prevent those when we're in the homes. Now, some areas that have adopted this, it is a 1 hour training. We have it available on our website. I would be glad to do one live, probably virtually, at least for the time being, for your department, but it is 1 hour. And at the end of this hour, what I will ask you to do is make sure that everyone on your department is trained in this DOSE on-scene education.
That's great. So thank you for giving us an overview of DOSE and kind of how we're looking at it in Michigan. Sam, can you tell us how we're going to implement that as our EMS for Children coordinator? And you're taking on the role of identifying pediatric champions at every agency and every area to kind of be that spoke for the hub that is EMS for Children in Michigan. And EMS for Children, like we spoke about earlier this week, is really a national federally funded program that allows every state and territory to have the opportunity to have somebody collecting all that information and getting it out to EMS so that they can best serve the pediatric patients. So it sounds like you're the person who's going to be rolling out the logistics for any agency or medical control authority or area that wants to roll out DOSE. Can you give us a description of how Michigan intends to use DOSE and EMS providers to prevent infant sleep-related deaths by changing their conditions through DOSE logistically?
Yeah, that's a fantastic point. So one of the things that I think we all want to take away from this is there are so many resources available, but sometimes that's not the most helpful thing. A quick Google search, you can find 8 million things left, right, and center. My job, really, if you think about it, is to facilitate bringing meaningful, helpful, real-world things right to the provider, right to the agency. And there's a couple things I'd love to highlight to show how we here in the EMS office, Terrie, myself, and honestly, the whole team of people that work on these sort of education initiatives and grant projects, how we're really trying to support the provider in their community. So DOSE, we always just kind of take it for granted, but it does stand for that acronym, the Direct On-Scene Education. So the provider needs the education, but that's only one piece. We want to provide that education, that training in the form of a module usually, or an online live session. We can do a larger session. There's a lot of great ways we can tackle it now that things have gone virtual. It's really opened the potential to reach more providers really easily. So one of the first steps that an agency or provider who's really interested in this topic could do is simply reach out to me. My email address is pretty easy to remember. It's Mishra, MISHRAS, @michigan.gov. And if you can't remember it, I'm willing to bet it's in the information section for this podcast, and you're going to start seeing it everywhere because we're really going to get this program going. So if nothing else, feel free to just reach out to me and say, I'm interested. I want to do something. Where do I start? And I can help you with that. That's my job. The other side of things is, how do I get resources to you, the provider, in a community? That's a great question. And that's what we've been working on behind the scenes. Terrie and I and a few others from the office actually have been really working closely with local entities as well as players at the state. And our job is to kind of facilitate that conversation. There's a branch of MPH that is literally titled Infant Safe Sleep. And those providers, they spend all day, every day working on ways to educate families, parents, and healthcare providers just like us on what we can do to help. So we actually brought DOS and educated them about how we can educate first responders and how first responders can play in. They had never done that before. So we've created a new link, and in turn, they are connecting us with tons of local resources. Actually, most counties have infant safe sleep specialists. And I use the word specialist a little broadly because every county is different. But instead of having you, the provider or the agency, try to figure it out on your own, that's where we come in. We connect you with those local resources to promote the longevity and implementation in your community with resources that you actually have. Not saying that, community A is the same as community B, C, and D. We really want to tailor it.
I think it's so important to recognize that nobody has to institute anything other than knowledge. These are resources that already exist. There's already funding to produce a person at every single county that is measuring and evaluating the safety of infants in that area. Then there is a state group at your offices that kind of look at it as a hub. So it's not like we have to institute anything when it comes to human beings, processes, buildings. We're at the point now where all the people exist, all the information exists. All we're doing now is passing that along to the people that enter into people's homes and can recognize a problem. As a firefighter paramedic, I walk into your home. If I see a hoarder house that's potentially a fire hazard, I'm going to say something. It's my job. All we're doing now is expanding that and taking that same prevention concept and going, oh, fire hazard, sleeping hazard, same concept. We need to say something. We're not here to admonish anybody or to make anybody feel bad. We're here to educate the public in a way that allows them to go, oh, I was unaware that I had a problem lying in wait. Many people don't know, because guess what? Sometimes babies just show up. People don't plan for them. People didn't expect to have one. And they didn't plan one for 9 months, and all of a sudden they have one. It's like, okay, what do I do now? So I'm willing to bet some of those people need a little bit of education and help knowing. So it's not like we are trying to change the paradigm in such a way that this is going to be difficult. All we're doing is sharing the information, getting on the same page, right?
You got it. And you 100% summarized that so well. You basically can just think of, if you want to think about Terrie and Sam over in the EMS office as your peds education go-to, and just reach out. Just say, hey, what do I have to do first? I'll walk you right through the process, and we'll customize it to what you need in your community. And then we'll bring those resources right to you, right to the provider in the community, and get you connected so that these programs can continue and be sustainable and completely relevant to the population that you take care of.
Fantastic. Other than contacting you guys, getting set up, getting my personnel trained, completing the trainings, and basically getting all my logistics set up and go out in the field, and when I need to educate people, other than that, what am I missing? It's that simple, huh?
It's that simple, Jeff.
I love it.
Tell you a quick story. We had in Battle Creek, a field supervisor there called me one day. And she was so excited that she said, our crews just took a lady in and she has an infant. And while they were there, they recognized she did not have a sleep space for the baby. So on their way to the hospital, they were talking to her about it. And, they said, we have a program. We have the ability to set up a pack and play for you. And she started crying. She was so thankful. She's been working. And during the story that she was telling them, she works and her brother babysits the infant. So they had asked her, does the brother babysit at home or at his place? And she said, no, at his place. So while they were talking, it ended up that the brother doesn't have a sleep environment either for that baby. So they called me and they said, we're already on our way to set up the pack and play at her place. Is it okay if we set one up at his as well? 100%. I said, do it. That we want these babies to live. And this story was so well received, not just by the agency and the people that were involved, but by that patient that they took in for a completely unrelated matter. And just in general conversation, were able to help her. That's a feel-good story. And those are the stories that can happen every single day in our business. So we're a part of the prevention.
So it sounds like that's the goal, right? That's not luck. that was planned, it was recognized, it was remediated, and so well, in fact, they said, well, this kid sleeps in 2 locations. This baby probably needs 2 pack-and-plays, and that's not a concern for the age. They're like, cool, 2, fine, great. It prevents the problem.
Right.
One of the things that happens in the first responder service is we get all these humans that are so motivated to help. And sometimes they do so much extra that they're the person. Like you could be the guy or girl who handles all cardiology. Like that's the go-to. And Steve's the trauma guy. Steve knows everything about trauma. And then we get people that get into the ped stuff. And I could see this program being the very important thing to a few people at an agency. And that's great for those people to be so passionate. But problem is those people eventually retire or they move positions within an organization. Maybe they're so good they became a chief or something like that. So after an agency adopts DOS, there's obviously a chance for it to fall to the wayside to a bit because more things are going to come down the pipe that may be distracting. So what's the plan to keep an LSA using DOS and really engaged?
Fantastic thoughts. And I think this is where having the EMS for Children program itself come in is going to help promote longevity and sustainability. So this program, it's been around literally for over 30 years. It's not going anywhere. We're never going to stop advocating for children to have better outcomes in the clinical setting, as well as preventing illness and injury. And this is what it comes down to. This saves babies' lives, babies less than 12 months old that are dying for preventable reasons. This initiative is never going to stop being supported. So right there, you have a partner always with EMS for Children program. I think one way that might be extremely beneficial for an agency or a region, however you guys want to roll it out in your communities, to promote longevity and sustainability is to appoint a pediatric champion. Have someone, just like you talked about, be that liaison between the EMS for Children program, which currently is Sam Mishra, that's going to talk with you and share stuff with you, but it could be someone else in the future. It could grow, which is what we're hoping for, but have someone be that connection to those resources, to the training, to the ongoing updates. Terry's actually going to be putting together an updated dose training so we can push that out to our network. So that's the first step. Get someone who's going to advocate, who's going to liaise, right? But how do you take that beyond? Because just like you said, people move on, they move up, they move over, wherever they need to go. So another way to build some longevity and sustainability in is to connect to your local partners. Your local health departments have infant safe sleep teams. They have fetal infant mortality review teams, abbreviated FIMR for all of us who love acronyms. So we're going to make those connections with you so you become part of a sustainable community approach to infant sleep loss. So those are 2 ways you can do it. And then another way is to consider making the training required. Maybe it's something that new hires need to do by X date, or do a pediatric seminar every 2-3 years for your team and always include dose. Make some rules about peds training and take the opportunity to take a step ahead and be prepared for those situations that involve pediatrics. So those are just a few ideas that we have seen agencies have some success about keeping this going. And Terry has taught me about many agencies that have been doing the dose program for years, and they've had plenty of turnaround, but they're still doing it and they're still leading the way. So it's totally doable.
Totally doable. I mean, we go on calls all the time. We're always keeping up to date on information. And the way I look at this is, in 2021, at some point, I'm going to be a part of pediatric education at my own agency. And we kind of have a process of how we do it, a general guideline of, we do pediatric medication administration. We look at our MyMedic cards. We do a bunch of overviews that we don't do a lot of time. I think what I'm going to do is add this component into the pediatric assessment. So if I'm going to do a 1-hour in-service with Terry, get my whole agency next year, the 2 years down the road, Terry's not coming back every year for an hour, right? So I need to take up as my pediatric champion in my agency, and I'm probably going to build in to my already existing PowerPoints and lesson plans that I use in my agency, dose. So if it's assessment, there's probably like 7 different lesson plans I have, and 3 or 4 of them probably have an opportunity to remind them about dose, explain dose, and the process, right? So I'm already thinking of how can I already implement it into my already existing situations. I don't have to do very much other than talk about it.
That's a really good point. Something I think you just hit on too, and maybe Terry can chime in, she can teach us all about this, is there's always train the trainer opportunities. Maybe you get a champion or somebody who might want to represent a few places or a few locations, especially smaller agencies out there. We know that you guys are busy and strapped for resources. We are not trying to provide more hurdles. We're trying to take hurdles down. So there are people out there that can help advocate, and we could get a train the trainer that could help train other agencies that don't have time to take this on or might feel a little overwhelmed. It's really our job to remove those hurdles and just get you the best information so that we just do better for these kids.
That's 100% correct, Sam. We've got a train the trainer program for that. Really, all it is about an extra half hour where I can just go over the supplies and how to implement the program and how to keep track of it. One of the things that we did on the EPCR last year, I believe, when it updated, was we added a little thing on there on the EPCR, and it should say something similar to, was infant safe sleep education completed on this call? And you would just click yes or no. All we want to know is if it happened. We don't keep track of who it is or where it is or anything like that. But the only way we're going to know when all of these death rates start going down, because they will, as we get more involved in our state, how can we track that back to EMS playing a very important role in that reduction in infant sleep-related deaths? This is the way we can do it. It wasn't to add any extra documentation for you. It literally is just a yes or no, or a yes if you did it. You may not even have to click no on your PCR, but it is there. It's a good way that we can track these numbers. At the end of the day, when we start going over last year's statistics, as they start reducing because of our efforts in prevention, we're going to be the heroes, as we should be. We are part of this prevention, and it's amazing.
Absolutely. Anytime you introduce an intervention, you got to track it, right? Because how do you know something works if you don't have a measuring stick? We can't all go, yep, worked. So that is a fantastic point to say, what did I do in my PCR? And that should be in your narrative too, describing some of the situation. Sure. Nobody's asking you to write a novel about the interaction between you and the mom, but you should say the patient's mother or whatever, the patient's family was maybe educated on safe sleep situations, check the box. And then that data is going to be very valuable through the future of EMS care, because it shows that we thoughtfully created and instituted an intervention, basically knowledge to EMS providers to help them teach people what is safe, and did it work? Well, this is one of the only ways we can use to measure that and have more programs to save more babies, or fill in the blank, save more, whatever the next thing is, right?
That's right.
Cool. Right now, all I got to do is I got to connect with Dr. Mishra and or Terrie to join the dose team. I get my personnel trained. It's basically once a year, spend an hour talking about it. The initial in-service is an hour. You can even get the information off of my train. We're going to have a lot more resources coming in the near future to expand the availability of this information. But then once my team is trained, essentially I get my pack and play support, individualized approach for agencies. And we basically do what we need to do based on the conditions of my community, because what I do at where I work is going to be different than what they do up north, where there's way less people or they're spread out and the agencies are just different. But our goal is the same. Educate the public on infant safe sleep, intervene when we can, politely and professionally, and do that in a way that best serves the community and the people around that. So to do that, in the meantime, if I'm listening, I probably want to know what resources currently exist to understand the problem where I'm at and how I can help in the long haul. So I'm guessing, Dr. Mishra, can you kind of walk over some of these resources for us?
Yeah, absolutely. So thank you again for highlighting the fact, just reach out. And if you have time to jot a couple of these resources down, or we can include them in the info section for this episode. I know that you get a lot of email addresses and websites thrown at you, but some of these are super easy to remember. So they're not hard. Michigan.gov/safe sleep. Told you that was easy. So I love this site. It is full of resources. If you are like me, I want things in color, I want pamphlets, and I want it to be so concise, because if I am talking to someone like you, they're probably going to stop listening after about 20 minutes, right? And you're like, God, stop talking. So you're like, I just want some content. And if you're a new parent or a pregnant woman, we don't have a lot of bandwidth left, and we need to just hear the facts. These pamphlets are awesome. They have pictures of safe sleep. They have pictures of what not to do. So if you don't have time to communicate, you have time to leave something with a family. Get some pamphlets if you have time. They're free. You can download them. You can share PDFs. And like I said, it's easy to remember, michigan.gov/safe sleep. On that same site, they actually have county breakdowns of safe sleep providers, just like I was talking about in those local health departments for the most part. Some counties have private entities that work on infant safe sleep, but it is a quick way to connect directly with your local resources. So if you're really moved and motivated after listening to this, you can actually find some of those local resources on your own, or just reach out to us, Terry and Sam. We can help put you right in contact. We can take the extra step out if you don't have time or you need a little bit of help. And on top of all that, we got tons of other resources related to the fetal infant mortality review networks, which are really, really good support individuals and programs in your communities. And we have other connections here at the office that we utilize to actually acquire pack and place and get them to you, and then help you set up a program so that you can have those into the future. But at the end of the day, what we really got to remember is we got to teach people about safe sleep for these babies. And it's as easy as ABC. The baby always sleeps alone on their back in a crib or pack and play with nothing else in there. So I think we can all remember ABC, and we can bring that to families all around us and help save the babies.
Save the babies. I love it. Any closing thoughts from you, Terry?
I'm very excited you guys are doing this and making this a well-known program, because I've been trying, but it's hard to get into every area of the state. So I really appreciate this outpouring of this podcast, and I'm very excited about this. I've said this already a million times. Let's prevent this stuff. And like I said, it's not just for the babies. It's not just for the families. It's for our mental health as well. And if we start taking care of each other and taking care of our community in a preventive manner, boy, we're going to do good things in our state. And I'm excited.
That is all for the show today, everyone. Thank you for listening. Thank you to Dr. Mishra and Terry Godde for coming on and spreading your knowledge. Your time and participation is always appreciated and never wasted. To learn more about how you can implement DOSE or obtain more information, go to their website, doseprogram.com. And you can find Terry and Sam's contact information in the episode description. Please keep emailing your questions, comments, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org. Check out our website, emsonair.com, for the latest information, podcast episodes, and other details. Follow us on Instagram at EMS On Air, and please, whatever podcast platform you use, subscribe to the podcast and leave us a rating and a review. It really helps us to grow this podcast. Thank you for listening to the EMS On Air podcast. Stay safe and have a great day.